I actually treated Felicity all those years ago when we looked at that picture there, is we actually started in her temples. And you didn't even realize that you had to have your temples treated, did you, Fliss? What did you think about when I told you, I'm going to start with your temples?
I thought it was quite scary.
She thought it was quite scary.
It's an area that you just don't assume that you were losing volume in even.
No, but then I think you sort of hear of that peanut head, which I thought I didn't really want.
It's amazing how beautiful women describe themselves as peanut heads, you know. But this is where we see, you know, a little bit of temporal volume loss. People describe it as hollowing, skeletalization if they've been sick. And then all we did was restore that, the outer cheek, the front of the cheek, and the area just underneath that. And we have codes that we call that, taught by one of our mentors, Dr. Maurizio De Maio. And we follow these injectable codes. There is strategy. And then we inject very lightly here. We never want to refill the whole nasolabial fold because we can make patients look quite odd by actually making everything look too perfect and too flawless. And by just augmenting all of these areas, what we see is a rotation of the face up and out. And everyone automatically looks more rested, less tired, more refreshed. So we're going to get you to turn and face the camera now very quickly, Fliss, if that's okay. And I want you to just take note, there's been absolutely zero downtime. She looks absolutely fine. How are you feeling?
Oh, fantastic, thank you.
You feel good?
Yeah, thank you.
So Cheryl, just point out the little bump she's got on her face, because that's normal.
Yes, we did discuss that before, so she knows they're going to be there for a few hours.
Great. And I'd love you to just hold that picture on the left side of Fliss. So that was from about 8 to 10 years ago. And this is her now. What do you think of her progression? It's pretty amazing, isn't it? To go from strength to strength. So if we can actually consult our patients and say with the correct treatment planning, combination treatments, great lifestyle.